In the last 4 or 5 years, manufacturers have gone through a process of starting to put policies in place to restrict covered entities' access to purchase 340B drugs through contract pharmacies. These vary widely in what the restrictions are, what medications they apply to, what covered entity types they apply to, and what's required in order to gain access back to those medications.
We monitor 340B ESP through email alerts and through notifications in the ESP portal. We're in there every single day, so we see those changes right when they occur.
And when a new or an updated restriction comes through, we research the impact of the new update to our clients, whether there are exemptions for grantee covered entities or for specific states that have passed protective legislation, the applicability of impacted medications to health centers, and then any data submission requirements.
So after we research the new policy update, we determine which entity it applies to, and then we will go in and make those designations. Or if the manufacturer still requires claim submission, we do that as well, as long as the entity chooses to.
When a health center works with us and they have not really done anything within 340B ESP to manage manufacturer restrictions yet, the first thing we do is review all of their OPACE registered sites, if they have any entity-owned pharmacies, and what their contract pharmacy volume is. Going through all this information, we can identify how many contract pharmacies they're able to designate through their associated sites, and also review to see which pharmacies make the most sense based on pharmacy volume, as well as where the pharmacies are located and which pharmacies may have cash plans for sliding fee scale patients. If any of the pharmacies that are going to be designated need to be registered on OPACE under associated sites, we work with the health center to do that during the next OPACE registration period at the beginning of the next quarter.
Once it's complete on OPACE, then we start the HIN process where we apply for a new HIN per associated site, and then we'll contact the wholesaler and update them. Once we update the wholesaler, then we'll go into ESP and make those designations, and then if the manufacturer requires claim submission, then we'll do that as well.
Going through the process of designating a contract pharmacy for each eligible associated site has helped a number of our clients regain access to 340B pricing for their patients, and also helped recover some of the 340B savings within their pharmacy program. One large health center we work with that had fully implemented the associated site contract pharmacy designation process recovered approximately $300,000 a month in 340B program savings. Another larger health center that is just beginning this process has already realized about $80,000 in 340B savings recovery per month. Even though keeping up with manufacturer restrictions can seem like it takes a full-time job because of how ever-changing it is and how complicated it is, it really can have such a huge impact on access to drugs for the patients in your community, as well as the 340B savings program for your organization.
If you need help managing your 340B manufacturer restrictions, reach out to us. We'd love to help you.